Acoustic neuroma or vestibular schwannoma is a tumor arising from the Schwann cells encircling the vestibulocochlear nerve. This vestibulocochlear nerve is the eighth cranial nerve. It arises at the junction between brainstem. For example, this is brainstem, midbrain, pons, medulla oblongata. Here cerebellum will be there. At the junction between this pons and cerebellum, this angle over here is called as Cerebellopontine angle. Why? Because it is between the junction between cerebellum, that is a little brain, and the pons. It arises at the CP angle. Therefore, it is also called as CP angle tumor, meaning Cerebellopontine angle tumor. So these are the various names given for acoustic neuroma. Comes from the acoustic nerve or the eighth cranial nerve. Vestibular schwannoma emerging from the Schwann cells of the vestibulocochlear nerve, which is forming the myelin sheath for that nerve. Also called as CP angle tumor, Cerebellopontine angle tumor. This tumor, since it is emerging from the eighth cranial nerve, first affects the hearing. Unilateral hearing loss will be there, that is sensory neural hearing loss. Subsequently, the patient gets problem with respect to vestibular system, that is with respect to balance. They also have tinnitus, that is ringing or hissing sensation in one of the ear. Then subsequently, the patient will develop imbalance symptoms and vertigo, that is giddiness. Since the neighboring nerves at the pontomedullary junction are seventh cranial nerve, compression of seventh cranial nerve results in facial palsy. The person will have facial palsy like this. And compression of the sixth cranial nerve, abducent nerve. Normally, abducent nerve helps in abduction of the eyeball like this. So, compression of that nerve results in internal squint. One eye will be looking straight forward, other eye will see inwards. That is called internal squint. The eye will be looking like this inwards. Then when the tumor, if at all it spreads downwards, there will be sequence of nerves, 9th, 10th and 11th cranial nerve in the similar line of that of 8th cranial nerve. So if it compresses the 9th cranial nerve, that is glossopharyngeal nerve, taste will be affected for the patient and also dysphagia, difficulty of swallowing will be there. If it further progresses and compresses the 10th cranial nerve or the vagus nerve, which controls the larynx and pharynx. Larynx, so obviously speech is affected, pharynx, deglutition. Swallowing is affected. Also, the vagus nerve controls the gastrointestinal tract, so the person will have problem with respect to digestion. Then compressing on 11th cranial nerve supplies the sternocleidomastoid here, this muscle, and trapezius. Compression of the accessory nerve results in problem with respect to movement of the neck like this, and trapezius helps in shrugging of the shoulder, so problem will be there with respect to that. So acoustic neuroma can be diagnosed by X-ray, CT scan and MRI, and by BERA technique, treatment, radiation therapy and surgical excision.